So at the back of the card, there is just the address and
Yes.
a special PIN number and so on for
So
it to
when you
be
go to
right.
the site and then do this, put your PIN number, automatically you have to put in your password, right? But that should change the information, but the information what comes up for the first responders to see as well. And the GPS locator will be activated once the first responder tap on that icon.
Now, what about the funding for this initiative? Where is the funding coming from?
The funding, well, it's going to be, we're hoping that it'll be a pilot project with the government of
Great.
Tobago.
Yeah.
Yes. Basically, we just want the device out there to show how NFC technology can be used in the healthcare sector. We have to get away from all these paperwork.
Yes.
And sometimes it's very tedious. For example, I use my experience in the health sector when I was in Tobago when I had my low blood sugar attack. Obvious, Miss Phillips was there, not only knowing my medical history, but the amount of paperwork you have to keep writing, then submit it to the next department. The nurse now could come with their phone, come with the card or bracelet, tap on it, get your medical records, send it directly from this phone to another phone of the superior, who may be the head nurse, and they could see the red flags. Okay, she's having a low blood sugar attack. We need to
Work
intervene right now than waiting for all this paperwork. So it saves time and it may save your life depending situation you are in.
Because you see, when you go to the hospital, you have to get your charge in, and then they take the paper and put it on a stack and then wait to see. But
Yes.
then again, you don't know who is more who is an emergency patient. So with this now, with that type of the card, boom, you send straight to the senior doctor. It's okay, good. We need to deal with this patient fast instead of having all these stacks there with the persons waiting. This card is fast and efficient. And I said, we have to put politics aside. I'm concerned about the health and the well-being of our people in Tobago space and Trinidad by extension. So I think this is a good initiative. We talk about funding. As I said, once the THA and the health secretary comes on board, we will have to look at the project and how much it will cost and how it will benefit the people of Trinidad and Tobago by extension. And for me as the ambassador, I'm also looking at source funding from the international market, as I'll be visiting
Certainly.
the United Nations next year. I will be there to also look for source of funding because, as I said, this is for the people of Tobago and Trinidad by extension.
No, when I mean, as you said, you could tap the card, you get all your information. Now, what happens to your actual information, in terms of like, the doctor's notes and things like that? Will that get uploaded onto that card as well? Because I mean, we have that complication within our space. A lot of times we go in for services, and as a patient, you don't have access to the records.
Well, the card also has that. We don't want to give too much because we're launching on Friday, so we don't want to give everything, so it will be a repeat. But everything will be there. You can update it at any time. For example, Candice, you go to Dr. Frank. Dr. Frank write a note, good. You go to Dr. Singh. Dr. Singh will say, stop the card, okay, good. Well, we see Dr. Frank wrote up a report. Yes, it will be there. Everything the card is going to be uploaded with all the information. If you get married 10 times, that will be there as well. So, the card it's good. This is the first, as I said, the first wave that is going to be given out to 20 persons. So far, we are looking for persons who are type 1 diabetic or who has diabetes. It could be children, it could be adults, but we're looking for more children. We're looking at persons with special needs. So far, we got 4 persons in Tobago. So we're looking at 10 to 15 persons in the Tobago space. So if anybody wants to contact me to be a part of the first wave, you can contact me at 680-6893 or 297, the office number 297-5667. The presentation is actually tomorrow. So you have until today to contact me so we could be able to list you so you can come and collect that first wave. You'll be the first persons creating history of this card being a part in Tobago and Trinidad and Tobago by extension.
And it was something remarkable because I mean we've heard the talks over the years about the need for a card, and this is the first time in my recollection that we are seeing it being presented.
Physically.
Yeah.
Yes. So you said that the first wave, 20 people, and you're targeting diabetic people just for the
Diabetic, special needs kids, persons with epilepsy, more persons who are, especially children who are unresponsive. Because I
Yes.
remember when I was in the hospital and we had a group of Signal Hills children coming, and the teacher didn't know who to call, where to call, and if that teacher would have just found that card on the child, boop, all these children could have been tended to at once, but they had to wait. The doctors couldn't do anything. So, this is great. And as I said, we put aside politics. Yes, it was mentioned way back in when I launched the politics, but as I said, I told her, I said, listen, we need to get this out for people of Trinidad and Tobago. We need to put aside the politics. I said it to the secretary. I said, despite whatever side we are on, this is not about politics. This is about the healthcare sector. This is about enhancing Tobago's image in the healthcare sector. As you see, technology is now the way forward, going forward. So I'm glad that we had that conversation with her. And I know Dr. Fade is always about progress and to seeing the healthcare sector go forward.
Definitely.
I have no problem with her in that regard. Anytime I have a problem, I can always message her. She is always responding, no matter how late it is.
All right. I know we're also talking, I mean, you said 20 people in the first part of it. Can more people be a part of it?
Well, it always has to go. Remember the cards.
I mean,
As
yes, of course, they will have a
yes,
cost.
there's a cost to it. So what we're trying to do, if we have Tobago, then I'm looking at the police service in Trinidad. We're looking at also Miracle St. Joseph in the Minister of Health area constituency. We're trying to get it all over so at least they can see the benefit to it.
Definitely.
And once the government of Tobago and the government of Trinidad comes on board and the packaging and pricing is good and it's efficient, because even though they come on board, there will be devices free of charge from the company
Yes.
to the specific. So example, 20 devices will be given to the Scarborough Hospital, and only the senior doctors in a casualty or the different departments will have access to that. The AMT persons on the ambulance will have access to that. So this is remarkable.
Yes.
Yeah, go ahead.
And another point too, most people might say, okay, they enhance the technology. I'm using, say, the government do embrace this technology. They might want to know a cost to the platform, but there will be no cost to the platform. We'll be teaching the personnel
Yes.
how to maintain the platform free.
Yeah, because it's
Yes.
Bismarck Technology and Learning Institution. So
Is that a local company? Or?
Yes,
Yeah, it's
it
a
is
local company.
Yes. It's been in existence for the past 12 years, but it first was known as Bismarck Medical Technology. We have added the learning platform because we are advancing to. There are many young people out there, even seniors, want to know much more about technology, especially artificial intelligent devices. So we teach individuals about AI devices. Also, we are now engaging into robotics. Well, that we are next.
And that's
Yes, for healthcare.
That's the
Yes.
future part of it.
So,
and
yeah.
sorry, that goes into hospital and physicians, personalized bracelets and cards, extended care providers. We have individual families and caregivers, disaster preparedness employees, and also this device is called TapMed. This part of it is used as TapMed. So as I said, we don't want to give too much. We're trying to hold back because the launch on Friday, we're going to have it at the Buku Community Center. It's also the prize giving ceremony for the Cornucopia show that I did for the persons who contested in the Calypso and the Mass and competition and the pre-launch of Cornucopia 23. So we're using the initiative also to bind it under TTU to Rise, because as you've seen, TTU to Rise has been in existence in 2015 and we have done so many projects unrecognized, and we continue to push between the odds to continue to fight for the people, especially the youths of Trinidad and Tobago. So with this initiative going there, we have more initiatives to come. We have more things to be released, and 2023 going forward, you will see a lot more coming out from TTU to Rise. And we have good executive. This is the Director of Health and Social Programs Initiatives for the TTU to Rise as well. We have everybody on board. We have a youth justice officer also that will look at the legal part of it and make sure that everything is in line and in good standing. So TTU to Rise has been doing good. Our anniversary on Friday will be 8 years in existence, and everything just come into play at the same point in time. So we're doing good, and we just want to make sure that the people of Trinidad and Tobago Extension benefit, especially the healthcare. I think the health sector is one of the most diverse part of all administrations in Trinidad and Tobago, and that is where we need to focus on.
All right. So as you said that there are still some spots open for people to be part of the pilot program.
Right.
So for those, especially the diabetics and children with special needs and so on, well, how can they reach you to be a part of the program?
Right. You can call me at 680-6893 or 2975.